My name is Andrew Kleski with Phymedica. I'm going to be presenting to you the Catalyst Electronic Medical Record. As you can see on our screen, we have the DocPad home screen. What we've done is we've given the physician the most important information that they look at on a daily basis right here in a dashboard. As we come down the screen, you're going to see incomplete notes. A physician walks through, sees a patient, but does not sign off on the note. It's going to put it into an incomplete status. We also have tests to review. A physician can easily see how many tests they have to review on a daily basis, and the number will show up over here. We have scheduled orders and procedures. Our system is very time dynamic, meaning it looks forwards and backwards in time. So a physician can easily see orders from yesterday, a week ago, a month ago, and they can also see any procedures or orders that may be in the future. We also have overdue prevention. I'll get into that a little bit more once we get into the face sheet of the patient. We have personalized the software. The biggest complaint with physicians is they do not want the EMR to slow them down. So what we've done is we've given them the capability to personalize their normals in the physical exam. And when we get into the physical exam, I will elaborate on that a little bit further. And then we also have medication requests. So any patients that call in for medication refills, that information can be easily sent to the physician, and the physician can see how many refills they have right here on their home screen. I'm going to go ahead and log into a patient. I'm going to go into Andy Anderson. And as you can see, when we pull up the face sheet, it looks just like a paper chart. Starting up here with the history, the medications, and family and social history. And then moving to our right, you can see it's tabs just like you would look at on a paper chart today. And then at the bottom, we have the workflow of a physician. And we follow the SOAP format: subjective, objective, assessment, and plan. And you can see the chief complaint, the history and present illness, the physical exam, the diagnosis, the order, the prescription, and then the final note. As we go through our electronic medical record, you're going to be seeing different ways that we can document information. Every time you see me choose a selection, write information, type information, and we also have the capability to be able to speak information, it's all being put into an elegant note, and it's put into a patented natural language generator. And we are the only electronic medical record with this function. What this does is it allows the physician to quickly move through the patient. It does all of their documentation so they can easily move on to see the next patient. Up here on the top left hand corner, you're going to see allergies. Why that's important is because we have an interaction between the allergies and our prescriptions. You can easily put in vitals and simply add vitals here. As you move down the screen, you're going to see you can look at any past notes. We're going to move over here to the prevention status. As I talked about at the beginning, we have overdue prevention. So what it allows you to do is set prevention statuses per code. So if they're overdue for an EKG or blood work, it's going to tell you if they're up to date or if they're not up to date. Simply move down the screen, you can look at results. So you can see if they're critical, abnormal, within normal limits. Simply move down the page, you can easily see the medical history, surgical history, and any past problems. I'm going to move into our chief complaint. And as we move into our chief complaint, you're going to see our system starts to get very graphical. And our system is age and gender specific. At the top, you'll see a search block. So we've given the end user multiple ways to search for information. I can simply go in and add shoulder if I would like to as a complaint. Come down here and say shoulder pain. Or I can easily go to the graphic, choose ENT, hit that arrow, choose ear, and now I can choose ear pain if I'd like to. So once again, you can have as many complaints as you would like. If I come down to a complaint and I want to add information down here, for example, patient not sleeping at night, this information is going to be documented and easily added to the note at the very end. Once again, everything that I'm choosing, everything that I'm writing and typing, and then we also have the speaking option, it's being documented and put into the natural language generator. I'm going to go into the history and present illness. And as we move into the history and present illness, you can see over here on the right hand side that I can easily change my complaint. But right now we're on shoulder pain, so we're going to stick with that. The onset we'll say was Monday the 5th. It happened suddenly. It affected the right shoulder. And then when I move down to the bottom, you're going to see where it's a surface of the actual right shoulder. So I can easily go in and just highlight the region of where that patient is complaining of pain. Once again, all being documented. Come up to the top here and I can say there's pain here, pain with movement, swelling, and I can also say that there's some weakness. and I can make it either a positive or a negative. Anytime you see these dots, you can easily drill down for further information or simply document information further here. So let's say that it's sharp. Done. I'm going to say that it's an acute injury. The timing is constant. It's very severe. It's improved by cold packs. Worsened by activity. And right now there's no other accompanying problems. Now as we move into our review of systems, one of the nicest things that we have in our program is the coding engine. And what the coding engine does is it follows exactly how much time and how much effort that physician is putting into the history and present illness and the physical exam. Physicians lose a significant amount of money per year by not documenting it correctly and then also not coding correctly. So as we go through this, you'll see how easy our system helps the doctor with the coding and also how easy it is to document that information. As we move into the review of systems, which is very important for the coding engine, I can simply swipe down to make everything a negative, or I could swipe up to make it a positive. So you can see how easy it is to maneuver through our program. As we come back up the screen, I'm going to come over here and I'm going to change the complaint to ear pain, and now I'm going to focus on the ear. We could do onset was the 5th also, so simply choose the calendar, hit the 5th. We can say it affected the left ear. Right now it's pretty severe. The timing is constant. There is a fever and drainage of the ear. Recently we're swimming. And once again, it's still saving the review of systems over here on the right hand side, so we no longer have to do the review of systems. Now I'm going to move into my physical exam. Now, as I talked about at the beginning, you can personalize the software and you can personalize the normals over here on the right hand side for your physical exam. And why that's important is because it allows the physician to quickly move through the things that are normal so they can focus on the things that are not normal. Simply choose general, make that green, lung and chest, the eyes, cardio, and maybe the GU here. And what we want to do is we want to focus on the shoulder, which was one of our complaints. So what I do is I choose the arrow, simply choose shoulder, click on that arrow also. Now I'm looking at the surface of the shoulder, so we can document information not only from the surface, but we can easily go into the muscles and tendons. And so now you can see how graphical our system really is. So once again, we did say it was the right shoulder, so I'm going to go over here and click on the right hand side, go back into my muscles and tendons. But as you can see, we also have bones and joints. We also have ligaments. We have different nerves. And then we also have sensations. So you can see how easy it is to document information just by clicking on the pictures. And they're actually working documents. So for example, if I choose rotator cuff, it's going to highlight that rotator cuff. What's nice about that is the physicians are used to these pictures, and it's a nice educational tool for the patient so you can keep that doctor-patient interaction. So I'm going to come down here to the bottom. I'm going to say there's instability and painful motion. So all that information is now being documented. And what I'm going to do is I'm going to come back into my head and ENT so we can focus on the ear pain. I'm going to simply come down to my ear, choose ear pain. Now I can highlight the tympanic membrane, and as you can see over here, it's now highlighting the tympanic membrane. We can say there's fluid behind the ear, that there's serious fluid, and we can also mention that there is maybe some pus behind the membrane. Hit close all. And now we're going to move to our diagnosis code. And what's nice about our diagnosis code is it's following exactly what that physician is doing. So there's not much that we have to go away from. We can easily choose shoulder pain. We want to make it a new problem. Or I can easily come over here to my ENT, choose that. We want to come over here to the ear, simply choose that. And now we're going to get the diagnosis codes for ear. It's a tympanic membrane. We're going to say maybe it's acute otitis media, or we can put otitis media up here in our search block simply by putting 3 letters there, otitis media 380.10. And now our diagnosis code comes down here to the bottom. Once again, every time you see these 3 dots, it gives you the capability of being able to document information a little bit further. If I come to my orders, what we've done is we've given the physician a way to customize their order. So we have the Accelerator common orders, which we have on our main screen here, but we've given the physician a way to customize my common orders. So that way, things that they do commonly can easily be customized and put on their own screen, and it will separate it by lab, radiology, procedures, and patient care. So it does put it into different types of functions so that physician can easily go in and do the information that they commonly do. So for example, let's do a shoulder x-ray of the right arm in one view. So that way when we come into our note, it will give us that documentation. We can also go into our prescriptions. Once again, we've given the customization of being able to make a hot list. So for example, if I want to come over here and search for Celebrex to give that patient Celebrex for their shoulder, simply choose Celebrex. I can come down here to the bottom, say I want it to be an oral, maybe 100 milligrams. I want to do it once a day for 30 days. Simply come down here. I can easily hit page down and sign that, and it will go electronically to the pharmacy of choice, or the end user can easily select what pharmacy they would like it to go to. And if I've used Celebrex commonly, I can simply hit hot and add that prescription to my hot list, so that way next time I want to find Celebrex, I don't have to search for it. I can go to it under my hot list. And that's going to bring us to our final note. And once we get to our final note, you're going to see all the information that we were choosing is now being documented for the physician. So as you can see, we have the progress note here, the patient's name, their complaint. Everything that I chose in the history and present illness is all being documented, put into prose. So it's a nice, elegant note that will be either sent to the insurance company or put into that patient's file. If I move down, you can see the review of systems that we chose. You can see any medical history. We're going to move down. You can see any surgical history, all active medications that they're on, or any previous medications they may be on. You can do different allergies. You're going to now see the physical exam. It's all being documented and put underneath in the final note. If I hit page down and keep going, it's going to give me my test results. It's going to give me my diagnosis code, also the x-ray that we performed, and then it's going to give you your E&M code. Now what's important with your E&M code is that you can simply choose, go in and see the documentation that you have done that produces this code. And this is where our coding engine comes into effect. So if we come over here, you can see how much time you spent in the history and present illness. You can also see how much time you spent in the physical exam. And you can even do your medical decision making if you would like. So let's say that the medical decision making was moderate. It's still going to keep it a 99214. Now if I wanted to override this code, simply can go to override. If not, what I want to do is choose done. I'm going to hit sign here. Now I can move on to the next patient. So now you can see how easy it is to maneuver through our program. Our electronic medical record was built by physicians for physicians. So it's made it very easy to follow that SOAP format and document the information that needs to be documented into that natural language generator and provide that elegant note at the very end.